Good morning, my name is Paula Coronel, and today I'm going to talk about respiratory papillomatosis. To start, I'm going to talk about the definition. RRP is caused by the human papillomavirus, which is a highly prevalent virus. In the voice box, HPV causes wart-like lesions that most commonly grow on or next to the vocal folds, but can also grow anywhere in the airway, above or below the vocal cords. In particularly severe cases, the lesions can spread into the lungs.
RRP, what exactly is that? What does it stand for?
I think that's a great question because recurrent respiratory papillomatosis, or RRP, is an HPV or human papillomavirus related problem. We're hearing a lot more about it because of HPV related to cervical cancers. Also, it's become much more prevalent because of HPV related base of tongue and tonsil cancers. But in both the pediatric or child age group and the adult group, RRP are like little cherry-like structures that grow all over the vocal cords. And they basically develop in the lining of the vocal cord. Anywhere there's a junction between two different types of skin, one that goes into the windpipe and one that's on the vocal cords, they can develop. And what they can do in children is lead to voice problems. They also lead to airway obstruction. They actually can block off the breathing tube. So we see that now in small children, like 1, 2, 3 years old. But in adults, it creates hoarseness.
Wow. Now, can something like RRP lead to cancer?
It has been shown, yeah. It's a small risk, under 5%, but yes, it can lead to cancer. So we do biopsy them and check for cancer each time. And I have had patients that have converted. I think one thing when you think of RRP in adults, you have to think of it's a sexually transmitted disease.
Okay, now, and how common is RRP?
It's not terribly common. I think HPV is far more common than RRP, but it is one manifestation of HPV. I think that's why it's really important that we consider a vaccination for HPV because it does block that type. So it decreases your risk of cervical cancer, decreases your risk of tonsil and base of tongue cancers, and it decreases your risk of developing these benign tumors of the vocal cords, which can cause breathing or voicing problems.
Applications in medicine. ARRP most commonly initially causes with a hoarse voice. This can be present very early on in a child and may have a hoarse cries as an infant. Most commonly, children are diagnosed around 3 or 4 years of age. As the lesions become larger, they can begin to cause airway obstruction. When it happens, you may notice a noisy breathing, difficulty breathing with exertion or during an illness. If left untreated, the airway can become clearly narrowed. It is important to seek evaluation if you are noticing these signs or symptoms persisting in the child.
My name is Rob Graton. I have been diagnosed with RRP since 2012. Living with RRP has really had its ups and downs. There's been times where I literally could not talk, and I would go into work and I sound like this. And my first reaction was not to say I have RRP. Again, there's just a stigma about it, and so I quite frankly would make up things. I would say, well, I have a nerve issue with my vocal cords. That's why I have to have several surgeries every year. They go in there, they laser that nerve, makes my voice better, and then it comes back. Or I have nodules on my vocal cords. But anything than to say I have, papillomas. My sister's in the medical field. She understood. Understanding, knowing that I have surgeries 4 times a year, I can't talk for 2 weeks afterward. I became depressed. It's it's like, wow, this is never going to go away. It's very costly. Anything possible that I read about, I tried. I said, I'll make it. It was that severe and that difficult every day, not being able to talk. I became very reclusive because when your voice, again, depending on where the papillomas are located, mine are in the anterior commissure, which is basically that bottom part of your vocal cord. And if I would go out to a bar or more or less a restaurant with friends or family, they couldn't hear me. It felt good to talk to somebody who had it, who had RRP. It felt awesome. Being diagnosed with RRP and having RRP has been, at its worst, havoc. It's been devastating. It's been scary, especially knowing that there are people who have died from this disease. On a day-to-day basis, there's not one day that I wake up that I don't think about and know about my diagnosis and my condition. But emotionally, it's taken its toll. Again, after 8 years, I gave up. I had tried everything, and still got it. What I like about Inovio's DNA medicines is that it's actually targeting the specific virus, the specific strands, the HPV 6 and 11 that are causing my disease. And if these medicines can eradicate that virus from my body, that hence stops the disease. And so that's what I'm really hopeful for.
Now, talking about the pros and cons of respiratory papillomatosis, we have although recurrent respiratory papillomatosis is a benign disease of the upper aerodigestive tract caused by the infection of papillomavirus, this disease can persist as an unpredictable way, ranging from mild disease and spontaneous remission to an aggressive disease with pulmonary spread and requirement for frequent surgical debulking procedures. It can be presented a protracted clinical course and cause potentially life-threatening compromise of the airways. Over recent decades, a number of alternative medical therapies to standard surgical treatment have been investigated with modest outcomes overall. Currently, some additional therapies are being explored, together with novel surgical instrumentation that can help to avoid inevitable long term stenotic complications, ultimately affecting the quality of the life of the patient. What is the issue applied in Ecuador? Human papillomavirus infection is the most commonly sexually transmitted disease in the world, and Ecuador is not exception. It is estimated that 70% of the population is a carrier of the virus. In Ecuador, the statistics of this disease are not estimated yet, but as the etiology is so elevating in the numbers every year, we can conclude that this is a very common disease.
Hello guys, this is Indian Medico, and in this video we are going to see about laryngeal papillomatosis or respiratory papillomatosis. This is a concise presentation for medical students. Laryngeal papillomatosis is also known as glottal papillomatosis. It is a rare medical condition caused by human papillomavirus infection of the throat. It has bimodal age distribution, that is, it is common in two age groups. It is common in children who are less than 5 years, and it is common in people in their fourth decade of life. Depending on this, there are two types of laryngeal papillomatosis. They are juvenile laryngeal papillomatosis and adult onset laryngeal papillomatosis. Juvenile laryngeal papillomatosis is the most common benign neoplasm of the larynx in children. Now let us see about the etiology of juvenile laryngeal papillomatosis. It is common in children between 3 to 5 years. It is caused by HPV virus type 6 and 11. Remember that HPV virus is a DNA virus. It is thought to spread from mothers who had vaginal HPV disease. Now let us see about the features of juvenile laryngeal papillomatosis. It mostly affects supraglottic and glottis regions. It can also affect subglottis, trachea and bronchi. The DNA virus particles are present in the cells of basement membrane of respiratory mucosa. This is thought to be the reason for the widespread involvement and recurrence of this condition. In children who have undergone tracheostomy, there is a risk for tracheal and stomal involvement due to seeding. Now let us see about the symptoms of juvenile laryngeal papillomatosis. There will be hoarseness, there will be aphonia, that is, the child will be unable to produce voice. There will be stridor, that is, high-pitched whistling sounds during breathing, and there will be respiratory difficulty. Now let us see about the diagnosis of juvenile laryngeal papillomatosis. Diagnosis can be made by flexible fiber optic laryngoscopy or direct laryngoscopy or by biopsy. This picture shows a patient with laryngeal papillomatosis. Now, how do you treat a case of juvenile laryngeal papillomatosis. Excision can be done by microlaryngoscopy and carbon dioxide laser. If these two are not available, cup forceps and debrider can also be used. Recurrence is common in juvenile laryngeal papillomatosis. The aim of the surgery should be to maintain a good airway, preserve voice, and avoid recurrence. So, the surgery should be done with absolute precision to avoid damage to the underlying vocal ligament. Medical treatment includes interferon alpha 2A and 13-cis retinoic acid. However, medical treatment is avoided because of the severe side effects. Now, let us see about adult onset papilloma. It is more or less similar to juvenile laryngeal papillomatosis. However, a few differences are there. It is usually single, it is smaller in size, it is less aggressive, it doesn't recur, it is common in men between 30 to 50 years of age, and it affects the anterior half of vocal cord or anterior commissure. Thank you.
In conclusion, we can say that respiratory papillomatosis (RRP) is a rare disorder characterized by the development of small wart-like growths which we know as papillomas in the respiratory tract. The respiratory tract is a system of organs within the body that allows individuals to breathe. Thank you.